Yay!
All
Hello,
right,
everyone.
we are live. So we got about, 5 minutes
5
until
minutes.
showtime. So we thought we'd invite people in to let us know where they're dialed in from.
Cynthia's taking a refresher course because she's getting back into coding. All right. You came to the right place. This is perfect timing.
And I want to acknowledge the first person who left us a comment, who is Tina Smith. Good evening at 7:42 Eastern. Boyd here, back on the CCO team.
Yes,
It's
but we
been a
got the band back together.
Yeah.
And
Yeah. This is going to be fun.
a lot of kudos to behind the scenes people, Jesus and Sylvia and Mary,
Yes,
Mhm.
all our helpers,
keeping everything together.
the little elves in the shop.
Keeping everything going. I have to tell you that when I was in uh, Michigan last week, they still remember us from our monthly YouTubes. Uh, People that came up and said that they recognized me and and because we took a little break, so we were
Awesome.
working on some other great projects, and so that's good news. Good news. So look forward to you guys being able to see more on our YouTube channel as well as other platforms because we have Facebook and LinkedIn that we're very active on.
Yep.
If you are not connected with us on LinkedIn, please take a moment to do so. One of the great advantages of LinkedIn, because it's a professional platform, Facebook, that's a little more casual, but LinkedIn is professionals talking to professionals. And what I found really advantageous is, I can go into Laureen's LinkedIn or even Boyd's, and then I can see who their connections are. And you can go into ours and see who our connections are. And
You sound like
that
a creepy
adds to the new.
stalker.
I know. It's awesome. You know, they do cap you at a certain limit. So
Yeah.
you can, but we'll be worthy of connecting to.
Yes. So we see everyone coming in. Just so you guys know, we had quite a number of registrants. I think, what was the final number, Boy? Was it like 1,400 or something? So we know we don't normally get most of these kind of webinars. You don't get everyone that registers, but we are capped at 1,000 for those that are coming into the StreamYard room. So I'm sure we'll have enough seats, but we are streaming on YouTube and Facebook and LinkedIn. So there's all different ways to find us. So someone's already asking about CEUs. I know that's one of the big draws, besides seeing the three of us. Alicia, why don't you bring up the next slide so people can be looking at that as they're coming in?
Sure.
We still have 2 minutes. So the way it works with these events, we only do like maybe 2 or 3 that are free CEUs. This is one of them. All the other monthly webinars that we do for our club members, and they get the CEUs, but we still stream, so you can still benefit from watching and getting the content. But if you want the CEUs, you got to be a club member. So for tonight, you can become a free forum member. And if you go to that link there, cco.pe/forum, you can get registered. So by the end of the call, when we give out the password, you'll be all set to go. It's just one question. Did you attend live? You say yes, and you get your certificate. That will be up for an hour after the webinar. So I'll have to repeat these instructions again because we're kind of saying it early, but for those that would like to get started and get that out of the way, it only takes a few minutes to put your name and email, and you'll be in our free forum. And lots of people ask questions there, and we will try and answer coding questions, or if they have questions just about career stuff, come and talk to us. And we've got a whole bunch of interns that help bring content and help answer questions too. So
I did
I'm
notice.
from Florida too.
Yes, I see a lot of people saying where you're from. Don't worry, guys. I know that when you're going to AAPC events, you have to put in your number. You do not have to do that here. You don't have to put in your member ID. I've noticed a lot of people doing that. That's fine if you did, but not necessary here, but we really enjoy knowing where you're from. So please do
Yes.
that. Absolutely. I am actually seeing several names that I know. That's fun. Yeah, that's and I also really enjoy seeing all the different platforms at once. So we are on the hour.
This is our first time doing it with StreamYard as a location versus just streaming to YouTube or Facebook or LinkedIn. So for those that are in the StreamYard area, let us know how it feels.
Mhm.
Because back in the day, we used to use GoToWebinar,
Yes.
and that's when Boyd, we really needed his help. So now he's here giving us extra recording support, making sure our sound is good and all that good stuff. So
Making us look good, right?
yeah, he'll be popping up your comments. Like I can click on comments. So hello everyone from Veronica. So if you see things like that pop up, that's Boyd or I probably doing that, because Alicia's the main presenter tonight. I'm her sidekick, and then in November when I do the CPT update, Alicia will be my sidekick. So
Ah, look.
And I'm herding both cats.
I was, yes. Now that you'll be able to tell if you're an old timer with us, because that's what Boyd used to say all the time.
yeah, if you want to put in the chat, when is the first time you ever attended a CCO webinar with us? We'll see if you're a newbie or an oldie.
That would be fabulous. Are we ready to get started? We're
Yeah,
on the hour. Do we want to give everybody a few more minutes? They're coming in like
yeah.
this. So
Let's bring up the next slide again, so those who are just coming in, they can see that. And then Boyd, maybe we can do the banner with the CEU info that they can get for the first 5 minutes or so. So for those that are just coming in, welcome. It is 8:02 Eastern time. This is probably going to go a little bit over an hour. We have a little commercial break in the middle. For those that are here for the CEU, you do need to go to our free forum and register there. The link is on the slide right in front of you. Maybe I'll post that in here. It is cco.pe/forum.
Daniel Riviera, 2011. Someone said they remember Laureen had short hair.
Yes,
Yes.
I now live in Florida, and I was a blonde for a while.
Yeah.
And very short, and then COVID came, couldn't get to the hairdresser, so I almost shaved it all off when my boys shaved their head out in the backyard. And I grew it in and thought maybe I'll look like one of those good older women with the gray hair that looks so pretty.
Yeah.
No. So I've gone back to my red brown color and just grew it out and trying something new. That's what us ladies do.
One thing I've noticed though, Laureen and I have changed quite a bit if you go back and look at the videos. However, Boyd looks exactly the same. His hair hasn't changed one iota. So you guys you'll notice that when you come back. I can see him smiling. All right, guys, just a quick review one more time. We're going to be doing some great giveaways. This is the 2025 ICD-10 update. Every year, one of the things that I posted on LinkedIn the other day was, are you tired of boring updates? We don't do that. We have fun. And as you guys know, I am fascinated and passionate about ICD-10. And just like every other year when the new updates come out, it's so exciting for me to see which codes got a lot of love. And we'll go over those individually. But some of you guys that are just now arriving know that you are going to get a CEU. At the end, we'll give more CEU information, and there's a banner at the bottom, as well as knowing that in the future, the webinars that we do, you'll be getting the CEU if you're a member of the CCO club. So that's right here at the bottom, really easy to find, cco.us/club. all kinds of benefits. Just pop out after the webinar, take a look, and see if being a club member is for you. I know there's several club members on tonight. I recognize the names in the conversations that we have. But the big giveaway is that we partnered with Find a Code. And tonight, if you stay till the end, you're going to be put in a drawing, and there's going to be some great stuff. I don't know, do a little hands up or however you do it over there if you are already a subscriber to Find a Code. If you're not, we're giving away 1-year subscription of Find a Code. Now, Laureen and I have been using Find a Code for a very long time. We speak its praises a lot because they listen to us. When we tell them there's something we'd like to see, we pop out a message and they say, yeah, we can do that. So that's for another time. If you already are a member, though, don't worry, because they're going to give one of 5 of the Meta Briefs 1-year subscription. Really, really cool stuff. Now, CCO, we're not going to leave you out. We're going to give you some free stuff too. You can have your choice of one of our blitzes, or you could have our new course. We have the QPIN course. Stay tuned. We're going to talk more about it in just a little bit. Okay. What is up with the new codes 2025? This year we have 252 codes. Can you believe it? There are 58 revised or changed codes, and there's 36 deleted codes. Something that I started last year was changing the way that I talked about the new codes. When you look at deleted codes versus the term expanded, that really truly tells you what they're doing with the code set, because they don't get rid of codes. They don't just throw them away. Because a disease doesn't go away. They do expand it though. So if a code is deleted, that means that it's getting more characters and being expanded. I'll show you examples of that in a little bit. So really, codes truly are not deleted. They're expanded. Revised or changed codes, 99% of the time, those are actually just expanding the way they describe the code. The description is expanded. And a lot of times you'll see that coding clinic, when they get a lot of questions on a specific code, they let them know that, hey, this needs to be fleshed out a little bit more for us. We're getting a lot of questions and stuff. They all talk to each other. So that's good news, right? Now, I want to just quickly show you here. You can see that I have my Find a Code up, but we're not going to look at all of those yet. I'm going to show you how you go find the codes. You're going to first go to codes and Find a Code. After you've logged in, you're going to go to diagnoses. I'm going to click on ICD. This is where you would search for codes. Now, I could go to the index. I could go to guidelines. I could look the codes. I could go to all of these things we find in our manuals. But look here. This is so simple. If this isn't the way that you're getting a heads up about the codes, then you're doing yourself a disservice, because this is going to save you time. All of the new codes are right here. And I know 250 new codes. And then I can scroll down, which I'm going to show you those in a little bit. That also changed codes. These are 58 codes that they changed the descriptions a little bit. And then deleted codes. These 36 codes, we're going to see that they were actually expanded in ICD. They weren't truly deleted. Now, there's never any reactivated codes, but here's all the new codes from 2024. And on top of that, if I want to look at a past year, look how far you can go back. I think that's brilliant. No more grabbing your manuals and trying to find that code. I'm going to go ahead and bring up the new codes. Now let's look at how we, first I want to show you the ones that caught my attention. My headset keeps coming off. Let me just adjust that. Boyd's going to get me for making noises with my headset. last year in 2024, there was a huge change in an expanded code. It was the perfect example of how codes are expanded as we see the need to track specific components of a new diagnosis. The one that they expanded was Parkinson's disease. Forever, Parkinson's has been G20. If you work with an older population, a geriatric population, then you saw this code quite a bit. It was real easy to remember, G20 Parkinson's. However, what they did was they expanded it to show dyskinesia. And what that did was with and without, if people have that shaking movement that's associated with Parkinson's, now we're able to build that out. That's how a code is deleted. G20 got deleted because it was expanded into a new code, G20 point A and B, and it expanded on there. So we're going to look at that. And I did pull out some specific highlights that I feel are very meaningful to you in your everyday practice, most likely. When you look every year at the new codes, some of us get a little intimidated, I know, because we see that number 200 and some, 300 and some codes. How am I going to remember these? Don't do that to yourself, because again, like I said, they're expanded. Now, there are brand new codes, ones that were not in the code set before. I've got one that I'm going to show you that you'll probably find useful. But the way we use Find a Code is to be able to pull those codes at your fingertips and be able to look at them. I'm going to give you the highlights, and then we're going to go back to Find a Code, and I'm going to talk about specific bundles of the new codes. No need to pay for education on new codes, because if you have a membership to Find a Code, it's all right there. And you saw that you could go back all the way. I think it was like 2012 or something like that, that they went all the way back. And we were just talking the other day, somebody said, do you have an old manual? I need to go see the old codes. I'm even going to show you real quick. Let me just do that before I forget. Say I want to look at the codes over here in 23, quarter 3. Look. Now that just changed the code set. How easy is that? Go to today. Yes. So simple. No more pulling out those manuals. I know it's hard to give out paper, but if you're reading this, then you know it's that time of year and there's a lot of changes. The first change that I wanted to highlight for you is the obesity class. Obesity is one of the codes that we use quite a bit, that in risk adjustment, if a patient has morbid obesity, they risk adjust. However, they can't just use the BMI. There's a lot of education we've done on that in the past. You can jump out to our YouTube channel or even find expanded education in the club regarding risk adjustment. What they did, though, was they expanded the classes in the E66.8. Now, that is other obesity right here, other obesity. This is not E66.9 morbid obesity or E66.2 obesity with hypovolemia, meaning they have breathing problems. This is other obesity. I worked on an encounter the other day, and the person had obesity, and the provider stated it was due to PCOS. That is an other obesity. That's not E66.9 that we're used to pulling, right? Or 0.01. No, this is other obesity for another reason besides calorie intake. But they have 3 classes that they added. Now, I put this in a lighter color. I know you can see it because this is not in the description. Low risk, moderate risk, and high risk. However, that is what class 1, 2, and 3 actually mean. And there's more information about that that expands, but that's for the provider to state that this person is a class 1, class 2, or class 3 obesity. And also, I can see why they did this because, first of all, no one wants to be told that they're fat or use that word obese. But when you use obesity class 1 or class 3, that's not as intimidating. And I know some providers kind of balk at now that they give the patient their documentation when they walk out the door and they have to have star ratings and everything. They don't want to have that conversation with their patient. Really, really cool. What is this going to allow us to do? Because we code for statistical purposes. It happens to be a convenient way to get paid. Remember, you guys that have been with us for a while, how I say that all the time. Because when somebody is other obesity and they're at low risk, now we can track that in the disease process compared to high risk. It's going to be telling. It's going to be able to help us follow the process of a specific disease. Now, additionally, specificity for capturing obesity in pediatric patients has been added to E66. So now you can have overweight and obesity that tells you to go to the BMI codes for pediatrics. That was also added, and that's going to be beneficial. The biggest expansion, the code ranges, the code area that got the most love this year was liquid cancers. Laureen and I were just talking about that before we came on. If you don't know what a liquid cancer is divided up into two groups. There's liquid cancer and there's solid cancer. Most of the time, we think of people having a solid cancer. So if you have a malignancy of the lung, of the brain, of the bone, of the ovaries, that's a solid cancer. However, a liquid cancer is lymphoma, leukemia, any type of blood or lymphatic system is considered a liquid cancer, and it's systemic. It goes through the entire body. That being said, it is different. If you talk to an oncologist, they'll tell you that liquid cancers never go away. And that's why you won't see a history of leukemia. That is not in the code set. Why is it not in there? Well, because it doesn't ever exist. Now, you can have a history of breast cancer because it can be eradicated. It can no longer be under treatment, et cetera, et cetera. Leukemia, a liquid cancer, isn't like that. It's systemic because your blood is through your whole body, and they don't know that little cells aren't still floating around. That's a whole nother story. We explain that in the education that we do. If you want to know more about it, the club is a great way to discuss that. That being said, all of the liquid cancers got additions that did not already have it put in, like leukemia already had this, but all of the codes that were liquid cancers that did not state in remission now have additional an additional code added for in remission. Liquid cancers, you have it, then it can be in remission or not, or remission unspecified. So you either have it active or in remission. So that is the majority. We've got the C codes or cancer codes. They start at C81, Hodgkin's lymphoma, all the way down to the T and K cell lymphomas. We'll look at more of that in a few minutes when we jump over to find a code.
Alicia, did you see the question from Melinda on the screen?
No, let me look. These three new codes for obesity class are not in the HCC model. However, class 3 is equivalent to severe obesity. Will these be included in the 25 mapping final? Good answer, Melinda. And guess what? I don't have an answer for you. And the reason I don't have an answer is because we don't have that final mapping. So we don't know. But now that you're aware that these new codes do exist, and that is severe obesity or equivalent to severe obesity, just being an other type, not calorie, E 66.9, E 66.8 with the other characters. Now that you're aware of that, you're going to find out. I suspect they will, I suspect it will, but I don't know 100% that it will because, in my mind, OSA should risk adjust, and they haven't done that yet, so they don't listen to me. Great question. Thank you for bringing that up, Melinda. All of you risk adjustment people, go ahead and put your little hand up if you're able to give us some risk adjustment love. And this is the new codes are very, very important to us when they come out every year for ICD. Let's move on to diabetes. Anytime that you want to teach something about the code set, especially the ICD code set, we usually teach via diabetes because it affects every body system. On top of that, not only does it affect every body system, but so many guidelines that permeate other body systems are also in diabetes, so that we can tell you, well, this is how you default, and this is why you default, et cetera, et cetera. And that's why, in diabetes, we default to type 2 because like 98% of all diabetics are type 2. Why do we default for paralysis to dominant side if it doesn't state? Because most people are right side dominant, things like that. So that any of you guys are instructors, give us a little shout out. They did add something that was really unusual and piqued my interest right away when I saw it. Pre-symptomatic diabetes for type 1. Now, we don't usually think of type 1 being pre-symptomatic. We think of type 2 absolutely pre-diabetes, right? I see that in charts all the time. They pull the A1Cs and there's like, oh yeah, we need to start taking these lifestyle changes or these considerations into account because you're pre-diabetic. But that's type 2. Type 1, you're born that way. So we don't really think about that. However, I suspect this may have something to do with ladder diabetics. I'm not sure. We'll have to see. But now most people think, well, they identify type 1 diabetes when you're young. That's why we used to call it juvenile diabetes. It's true. A lot of times they do. However, it's not like that all of the time. Sometimes you can be a type 1 diabetic and you don't find it until later in life. And if you're 40 years old and they identify you as a diabetic, they still test you to see if you're type 1 or type 2. If you understand the disease process, that kind of feels wonky in your brain. But this tells you that we have a lot of people out there that they need to track that are pre-symptomatic type 1, that we know they're a type 1 diabetic, but they're not exhibiting any of the signs and symptoms yet. That's what pre-symptomatic means. So they're a type 1 E10, type 2 is E11. So they're E10, and we have unspecified, stage 1 and stage 2. Now, I didn't go into a lot of detail about the stages because this is a lot of information. We'll go look at it when we bring up Find a Code. Let's jump into the additional added content for our type 2 diabetics and our other specified, like the LADA diabetics. They put in the description or a heads up that says, if these patients are using non-insulin anti-diabetic drugs, this is the code Z79.85. We knew that, but we weren't prompted to do that in the past through the coding manuals. Now it's included. So that's a revision, not a new code, but a revision to the description. In addition, they added hypoglycemia levels. Now, I thought this was pretty cool too, because I have known people that suffer from hypoglycemia and they've leveled it out. So you're either a level 1, which is mild, level 2, moderate, and severe, level 3. A lot of disease process information that goes on into people that suffer hypoglycemia up and down. Know that now E16 is for patients that are hypoglycemic. This is not, do not get this confused with type 2 diabetics that are having hypoglycemia. Okay, that's an E11.649. Okay, that's not the same. This is a patient that does not have diabetes but has hypoglycemia. They keep having blood sugars that drop. All right. Exciting news. Eating disorders. That got a little love this time. One of the things that they did was they expanded all of the different types. So we have anorexia nervosa, we have anorexia nervosa binge eating or purge type, bulimia nervosa, and binge eating disorder and other eating disorders. So we have 4 different ones. What they added was leveling: mild, moderate, and severe. So if you go back to your office and you're going to let your providers know that you just listened to the CCO 2025 updates for ICD-10, and that for those patients, now we need documentation, mild, moderate, and severe on all eating disorders. Don't be throwing codes at them. They don't like that. They don't need to know that. All they need to know is that we can get to a higher specificity and description now, and therefore let us know if it's mild, moderate, or severe with eating disorders. An example would be F50.010, and that's anorexia nervosa, restricting type, mild. And that also, when they say mild, it gives you the BMI equal to. So you can decide in your office if you're going to let them do mild, moderate, or severe, or if the provider gives you permission to do it based on the BMI. That's something internal that you guys can walk through. With the eating disorders, this is a really unique example of how they expanded, but they also made a new code. So they busted up a code and they took other specified eating disorders, pica or pica, however you want to say that, in adults, or psychogenic loss of appetite, which is F50.89. That's what it is right now, 2024. So when you see the description, then you go into find a code and you look at it for the new year. What they did was they took out pica in adults and they gave it its own code. So this code was added for 25, F50.83, pica in adults, or in remission. It doesn't matter. It's the same code, F50.83. Note that that does exclude in children, in infancy and children. That's got its own code. That's an F98 code. So what we had before, the description as of 24 new codes, pica, or that wasn't new code, it just existed. That was part of other specified eating disorders. I guess enough people got it or had that diagnosis that they busted it up, and now it's a brand new code. It's not a changed code or a revised code. It grew up and got its own code. Just kind of wrapping up before we jump into a quick commercial, and then we go look at find a code to really break down and see all the other exciting codes that got some love, is some special mentions. G90.81, serotonin syndrome. That's a new code that didn't exist before, as well as G93.45, developmental and epileptic encephalopathy. That's I see encephalopathy a lot in documentation. I16.1, hypertensive emergency, now includes several new use additional codes and instructions. When you look at the codes and you look like and find a code and it'll say use an addition, that means that if you're going to code I16.1, that in addition, these may be applicable. You're going to code those as well. Additional new code was added to I26 pulmonary embolism series. There was encounter for sepsis aftercare has been added, a Z51 code, and a new code, Z59.71, insufficient healthcare coverage, and Z59.72, insufficient welfare support. These are social determination of health codes, SDOHs, 2 new SDOH codes that probably will be applicable in your office. So now it's time for a quick commercial break. We are right on time. Fabulous that we're able to do that still after not being in the rodeo seat for a while, right, Laureen?
Well, yeah, definitely together with multiple people. So you've been handling it very well, Alicia. So yeah, so this first thing we're very excited about. This was all Alicia's idea, and she pulled it together. I'm really, really thrilled with this, and of course our helpers behind the scenes creating the getting it into our course area and sales page. I'm going to let Alicia do this slide, and I'll do the next one because she knows all about it, and I'm going to turn my face off.
As some of you guys know, that in 24, one of the new codes that we got was G0023 for CPT. And there was a big scramble. How do we use this code? We want to be able to use it. Well, honestly, when you look at the description, you have to be trained to use this code. And let's look at that real quick. What is it? It's a patient illness navigator, and it says services by certified or trained auxiliary personnel. Most of the time, PINs are working with oncology. That's historically what they've always used it for. Then there's more of a full description of the code itself, but we had providers come and ask us, and they say, hey, can you give us a lecture on the use of G0023? I said, sure, we can do that. However, what do you have in mind? And several of them were thinking, well, we want to offer this service that's going to help our patient population, but they didn't realize this. You got to be certified or trained. So we created that. Let me show you what it looks like here in that code. Just go to G0023 and find a code, and it tells you, hey, this was added in 2024. And the reason you need training is look how long the description is. All of that information is pertinent. Therefore, we created a course so that with confidence that you're able to implement this code for your patient population. It is kind of a cross between a little bit of social work and a liaison for the patient and the team. We see this being used a lot in family practice. With complex patients, so that nobody slips through the cracks. And again, there's a lot of criteria and more information that you can find out about it on the site, cco.us/QPIN-course, and then we give you a certificate stating that you've gone through the course. Ideally, these are people that have medical training like MAs, or somebody that's already actively working with your patients, because we don't teach anatomy, physiology, and all the other stuff. We have those courses, but this course was designed for people already working for you that want to pick up and be able to offer this service.
And that's going to be one of our giveaways at the end. So
yes, it's so cool.
Actually, why don't we do that now? Let's do the giveaway for the QPIN now. That'll go
Good
right with it.
idea. Boyd, are you ready for that? Can you do that?
Well, we have, I think, 14, let's see, I'm just refreshing it, 1,446 registrants. So I'm going to export that spreadsheet.
Now, do they have to be here to win?
Yes.
Okay.
And I've got...
That's exciting, guys. While she's doing that, let me tell you about some of the other CCO news. So she's getting that set up. We do flash sales from time to time. Laureen just interrupted me and tell me when you're ready, okay? And now we're doing 35% off select courses. Remember I said that we have an MTA, medical terminology and anatomy course. We also have pharmacology and pathophysiology. We're thinking about adding some others that that have been requested on top of all of the other courses for the different credentials. Are you ready?
I'm ready. So if you could do me, I'm going to share my screen. Present.
Okay.
Share screen. And I want to do... All right. You see my little random generator
Fair
here?
enough.
Okay, so we're going to go between 1446 and the first row is, there we go. Let's see what it tells us. 168. So now I'm going to go to 168 on my spreadsheet.
Mind you, this is all the platforms. This is people that are live here on StreamYard, also on Facebook and on LinkedIn and YouTube. So because, you know, less than half, about half of that is actually in the stream.
So I have Janelle Montilla, Montilla.
Janelle. All right.
So
Now,
you won the QPIN course. So what you'll want to do is reach out to the help desk and let them know you won. We've made a note of your name, and Sylvia will get you hooked up with that QPIN course.
and I just posted the help desk at cco.us in the chat so that you guys can look at that.
Congratulations.
How exciting.
All right, so
You
I'll
wanna-
stop sharing and we can go back to your screen. So we're going back. We had taken a hiatus thanks to COVID and everything with our monthly webinars. So we're going to be back to doing that, Alicia and I together, and occasional guests that we'll bring in. So those are not free CEUs. We do it for our club members, but we will push out and we'll broadcast. So anyone that wants to listen can. But if you want those CEUs, then join the club. That's what it's for. Coming up in November, we're going to be doing the CPT version of this webinar. That one will be a free one. And that one I'll be doing more of the presenting, and Alicia will be supporting me. And that will be with Find a Code again, kind of showing you the changes and taking you into Find a Code, so you kind of get both. And then that one will also have free CEUs and giveaways. Then in December, going to be doing we did it last year, a live blitz where we split it up 2 different Saturdays. I think that's how we did it. And that worked really well. So we had a live audience. They were awesome. We used StreamYard just like here. It was all day. And what was nice is we could do the chat. I pre-recorded my lectures, and then we all sat there and had a watch party, and we were chatting in the side chat as it was going on. So it was like legal passing notes in class. So these are some things to look forward to. If you're really behind on your CEUs, you could do the blitz and you could get like all your CEUs at once. But it's designed for people that are getting ready to sit for their certification exam and they want that refresher. You can have taken a course anywhere, and it's designed to help prep you for that. And a big using the BAT system that we teach with the bubbling and highlighting and annotating. So yeah, so that's what's coming up. If you guys have any questions on that, just reach out to our help desk. Sylvia's wonderful, and we'll get you pointed in the right direction. If you're not sure what course to take, but you know you want to do something, we can help give you guidance on that. You can schedule calls with Alicia and myself, and just get some advice that way. Okay.
I can tell you that there have been times when people thought that they knew what they wanted, and then we talked to them and got a little bit of information about their background or what their goals were, and realized, you know what, that's maybe not the path you want. You might want to consider this other path, and then tell them why, and kind of have an aha moment. It's a lot of fun to do that and help kind of guide people, because we've been there. We have a little more insight maybe than you do. So I want to bring over Find a Code real quick. Let's look at these codes a little more in depth. And I want to show you, again, starting at the very first code. This is how easy it is to do this with Find a Code. The very first code is C81.08. All of these codes are alphanumeric. That means that if I want to scroll down real quick and see that new diabetes code that would start with an E, it's real easy for me to do. I just have to scroll down real quick and I can find E16. Note, all of these codes that I'm showing you right now, all of these C81 codes are liquid cancers. And what did they add? They added in remission. Every single one of those. This code already existed, And now they've added this A for in remission. If you had nodular sclerosis, Hodgkin's lymphoma, and you're not needing treatment right now, it never goes away. You're never a history when you have a liquid cancer or lymphoma like that. But now they can track the people that go in remission. So that's really, really exciting. We need that for statistical purposes and showing what medications work and what medications don't for these different liquid cancers. Another thing that might be beneficial to you on an educational standpoint is when you have these new codes drop, sometimes it's a good refresher to say, hey, I didn't even know that there was a follicular lymphoma. Laureen and I were just talking about that. She goes, I didn't even know that was a thing. It's like, yeah, there is. Well, since you don't know about that, then you go out and do some research on it, and you've just gotten education on something you weren't familiar with. So it's kind of fun. I do that every time the new codes. I think, oh yeah, I know what that is. I was like, what? I don't know what that one is. Now, a lot of times I'll go through and find some fun ones, and I'll tell you what they are. But I didn't do that as much this time, because I knew there was a lot of stuff that we needed to get through. Although I do have some fun stuff to tell you. Non-Hodgkin's lymphoma, you're probably familiar with that. Unspecified because there's several types of non-Hodgkin's lymphoma, and they have an in remission for it. Now, notice here that they also have not having achieved remission. Okay, so if you see that here, this other specified types of non-Hodgkin's lymphoma in remission, that's because there was already a code for it, is not having achieved remission. It was already built in. Now you see that this one is in remission and not having achieved remission, meaning it's active. Okay. Let's just go through these quickly. Look how many of these C8 codes are. This is all types of cancers, different affecting different body areas as well, even though it's a liquid cancer. Now we get out of the C8 codes and we go into D. There's only one D code this year, and you guys, I don't know how to pronounce this properly, but I'm going to say it's Fanconi, which it may not be, anemia, a specific type of anemia. Now, I can tell you that sometimes it's already built in, sometimes it's not. No, the descriptions aren't there yet. If once this is moved in it and we are using the new codes, then they will have descriptions for you. So that's helpful. Remember those type 1 pre-symptomatic codes? Here they are, the pre-symptomatic codes. All right. Let's see. Let's see if we get any descriptions on those. The information. Nope. Nope. But I do know there is some on some of the others. There's those hypoglycemia E16 that I told you about, carcinoid syndrome, and carcinoid heart syndrome. There's those obesity class 1, 2, and 3 that we spoke of. Other obesity not elsewhere classified. Now we're going into some other things that I'm not as familiar with, but you can tell that metabolic issues did get some love, because here's some more E codes. Not only was it the eating disorders, but we have other disorders of citrate metabolism, as well as the MC4R pathway, obesity due to that. Anorexia, there's all kinds of anorexia codes. Remember what I told you how many new codes we had? Look how many were all those cancer codes that were added in remission. That's the bulk of what was added. Now there's all these anorexia codes. We got over a dozen of them, because with each one of the 4 types, we had to add mild, moderate, and severe, and they even added extreme. Mild, moderate, severe, and extreme. I didn't put that in the notes. But we also have extreme. And then unspecified. Right? It's like when we went from 9 to 10 and they expanded all of those codes, those T codes, remember? There's that pica or pica in adults. Now we get into G codes. G codes have to do anything with the brain, the central nervous system usually. And we got a lot of codes added for epilepsy. Some of you guys remember I have a son with epilepsy. They didn't add anything to the epilepsies that he has, but they did add some new ones. And with epilepsy, when they add, there's with status epilepticus and without status epilepticus. This is a specific, this KCNQ2 is a specific type of epilepsy that they get from doing genetic testing. So my son has genetic testing done once every 5 or 6 years because they learn new things about the genetics. Autonomic nervous system disorders, more G. Then we jump all the way into I codes. I thought this was kind of funny because it just seems funny. Cement embolism. Now we know what an embolism is. It's that clot. You can have a pulmonary embolism, and this is cement embolism. I didn't do the research yet to see what is a cement embolism. My brain just went out there thinking of what it could mean. It was kind of exciting. We are familiar with fat embolisms. You know, I know what those are, and I don't know, but I'm suspecting it's not when the fat clot, but like a ossified calcium is lets loose and gets caught. I'm assuming that's what it is. You guys now have something that you can go research and find out. Let's see, we have internal nasal valve collapse. Never had I seen that before. That is a in your nose back farther. There is a valve there, but we didn't have a code for it collapsing in the past. So we have unspecified static dynamic, and then external. Uh, Again, kind of cool. Then the Tushy got a little love. So Tushy love here, a lot of codes for fistulas, anal fistulas. Um, we've got, let's see, they went into unspecified simple, and then we've got initial, simple persistent, simple recurrent, and simple unspecified. So we have unspecified, then simple with our 4 choices, and then we've got complex. And then we're still doing other parts of the Tushy anatomy. So we have anal, we have rectal, the same thing. And then we move on anal rectal. So that's a lot of codes there for the Tushy. Um, a big bulk of those codes. And with each one, not only have, you have the severity, but we have to have initial, persistent, recurrent, and unspecified. Now we're going into the L codes. We only got not as many L codes. Other pruritus, I mean, these L codes are skin conditions. You may recognize this type of alopecia. That's a word you're probably familiar with. And let's see, then we move into M codes. M codes have to do with the musculoskeletal system. And notice here that we have disc degeneration. And then whenever you have disc degeneration, they're going to have you divided up. This is the lumbar region. Okay. And then we've got dysfunction of the multi, even my glasses, my bifocals aren't working, multifidus muscle, and then synoviatus, I guess is how you say that synovial fluid gets, all that gets inflamed in the tendons and the synovial fluids in the joints. All right, so look at that again. We have anatomy, laterality, right hand, left hand, unspecified, right thigh, left thigh, unspecified, ankle. So all of those joints. Going into those quirky Q codes. Q codes are genetic codes. Bicuspid aortic valve, congenital mitral valve, cleft leaflet. Now, these are new codes, and they weren't expanded. These were actually new codes. This Kleefstra syndrome, another one that's kind of unique. Go out and look that up. R codes is signs and symptoms. And then T codes. Yeah, we got a few, but what they did was they expanded some of the poisoning codes. So we have poisoning by immune checkpoint inhibitors and immunosuppressant drugs accidental. Think about this. We have been using immunosuppressant drugs for several different things, but different cancers and stuff. Now we're able to say that the person either accidentally took too much or took too little, so on and so forth, like we do with other types of drugs on the poisonings. And we have initial encounter, self-harm, sequela, all of that. That's why that's expanded. So they've identified a new medication, these immunostimulant drugs, and then we have to build out all those additional linkages, like you said, with T codes, where we have the S, the A, the D, and so on and so forth. Let's see, checkpoint still going on for those. Then we got into disruption or disheasance of a gastrointestinal tract anastomosis repair. So if you don't know what a disheasance is, that's when you've had a surgical procedure done, and anastomosis is when they're putting stuff back together. So a disheasance just means it comes undone. And now we have a disruption or disadhesence of this anastomosis of the gastrointestinal tract, in other words, surgery to the gastrointestinal tract. And then with these, we've got initial encounter, subsequent, and sequela, and so on and so forth. Then that was gastrointestinal tract. We have internal closure of internal operations, surgical of the abdominal wall or fascia, and then it goes on again to describe other types and areas of wounds that would have a disheasance or a disruption. Now we're getting to the Z codes. We're getting to the end. We're getting close to wrapping up, and we are right on time. Genetic susceptibility to epilepsy and neurodevelopment disorders. Take a minute to take that in. Genetic susceptibility. Wow, we can track that. Isn't that amazing? Let's see. Genetic susceptibility to obesity. Right? That's pretty exciting. Progesterone receptor positive status. Progesterone that will follow cancers that are hormone types of cancers. They want to know if you're negative or positive. Let's see, human epidermal growth factor receptor 2 positive status. I can honestly tell you, I know nothing about that, but kind of cool. All right, then we wrap those up with going into that encounter for sepsis aftercare. If the patient had had sepsis, it takes a long time to recover from that. They're usually in the hospital for a long time. When they go into their provider afterwards or any type of aftercare, now they can track sepsis recovery with this Z51.A. Again, why are we doing what we do? We're tracking those statistics. Insufficient health coverage, we talked about that. Now, again, this one, I do not know what it is. Go have a little fun, look it up. Duffy null, Duffy A positive, Duffy B positive, and Duffy A and B positive. I honestly, I remember looking it up. I just can't remember what it was. So take some time to go look that up. And then we wrap it up with the body index for pediatric that I told you about, that they're able to track that. We've got some personal history codes of, again, the intestinal tract tushy, colon polyps. There we go, guys. Look how easy that is. And again, real quick, all you have to do is go to your codes, pick diagnosis codes, hit ICD, then we look here. If you want to know about the deleted codes, remember there's only 36. And guess what? Look, there are all of these cancer codes. So real easy to go through those. They were expanded. Super, super simple. All right, let's get back to our slide deck. Let me move this out of the way. Got a few more things that we want to show you. Are you back, Laureen?
I did look up Duffy. You want to know about Duffy?
Yes. What is Duffy? I forgot what it was.
Well, Copilot says the Duffy blood group system includes two main antigens, A and B. These antigens are found on the surface of red blood cells and are encoded by the FY gene. When someone is Duffy A and B positive, it means they have both the FYA and the FYB antigens on their red blood cells. And null means they don't have it.
That I kind of thought it was something to do with blood in the back of my mind, because I remember looking it up and I couldn't remember, and I didn't want to actually say something and be stupid. And you guys, that wouldn't be good. Better to keep your mouth shut and prove that you're not a fool, right?
Right.
Thanks for looking that up. We appreciate that. Now you guys know Duffy, and you can go back to your office tomorrow and tell everybody you learned something from CCO.
Yeah, I was trying to put that in as a little banner, but it might be too many words. Okay, so very good. Thank you, Alicia. We got really good timing. And so apparently people aren't getting their emails because we have, let's see, close to 550 people live that have been hitting the server. So we're going to give it more time. We're not going to just leave it up for an hour. We'll leave it up for 24 hours. So check back tomorrow morning. When you get that email, log in. This is the password that you want to remember. Please don't share this. This is for people that attended live. We do have a recorded version that people can get from the club, but this is just for people who took the time to spend with us tonight. And it's Green Tree, all one word, GREENTREE. So write that down, one word, all together, no spaces, no dashes, no hyphens. And when you get into the free forum area, you'll see the screenshot, and you'll want to click where it says, where number 1 on the screen says, there's a tab that says exams. So you'll click on that. And then you go to number 2, you're looking for the free CEUs. And then you're going to pick this one, the 2025 ICD-10 Update. And by the way, once you get in there, we've got a couple other freebies in there, so check it out. And so you're going to go to the cco.community/exams. We'll get you there. So wait for that email to make sure you get logged in. This is the password you're going to need, Green Tree. Okay? And let's do the rest of the drawings.
Okay.
So we've got, we did the Q pin. Let's do find a code now.
And just real quick, Talicia Bundy said, thank you. Do I put CEUs in my resume? I wouldn't worry about that.
Yeah, that's what I said. That's why they have you maintaining your certifications by attending these. So you keep track, and whatever organization you're certified with. I'm with QPro now. Alicia does both. She's with AAPC and QPro. So whatever organization you deal with, they're keeping track. So as long as you keep, maintain that credential, then that is you telling them that you've already done webinars. You don't have to tell them exactly what ones. So, but good question. When you're new, you don't know what do I put on there. But it is good to put what memberships you're a part of. Like, are you a QPro member? Are you an AAPC member? A HEMA? Like any of those kind of things. Are you a chapter officer? Put that down. Those are good things to include on your resume. Okay, let's do another drawing. I'm just going to leave it up and just generate the number. You guys trust me, right?
Do you want me to
right,
not stop sharing?
No, leave that up because that's what they're probably interested in right now. All right, so 1214. Let me bring my spreadsheet over here. Fantastic numbers. Got to keep scrolling. Wow.
I really enjoy seeing everybody's comments.
All right. Where's my 1214?
Yes, Dawn, AAPC and a HEMA. If you guys are not part of a CEDUS, that's another one.
Sarah Elva. Sarah Elva has won the Find a Code subscription. Congratulations.
Yes.
So Sarah, reach out to our help desk, and we'll give your name and email to the Find a Code folks. Just say, I won the Find a Code subscription. So congratulations. That is a phenomenal gift. All right, I'm going to run the generator again and see what number I get. Now we're going to do one of the Find a Code abbreviation
subscription.
That's something new that they just started offering. It's normally an upgrade, but this you would get for free for a year. So $11.95.
I still look up abbreviations. I looked up one the other day. I was shocked. I didn't know what it was.
Riley Koch, Koch, Riley Koch won one of the abbreviations. So congratulations, Riley. Same thing for you. Reach out to our help desk. Let them know that you won one of the abbreviations. I'm going to generate it again. I think they said 5 of them. They're being very generous. Okay, it's not really going too far. $11.96. I just did that one, didn't I? Looking for my Amanda Richards. You're the second med abbreviation subscription winner, Amanda Richards.
Someone said, wow, giveaways, prizes. That's right. We try to always, when we do webinars, to give something away.
We don't normally do this many. Findico.
No, Findico was very generous.
All right, the next one is Angie Carmine. Angie Carmine. She is the third med abbreviation subscription winner. All right, 482. I got to really scroll for that one. Hang on. 482. 482.
Yes, Terry. Find a Code is free. They have a free version, and then they have a paid version of Find a Code.
Sonia Harrison. Sonia Harrison. And we got one more. 1342.
What did Sonia win?
She was the fourth Metabreed.
Yeah, I was like, they're giving away a lot. I kept thinking that was it. Is there one more?
This is the last one, 1342. 1342. That's Mary. Oh, she's got a long name here. Hang on. It almost looks like Thanksgiving. Mary Hannah Kingsing. I'm sorry if I'm butchering your name.
I think you did.
Taryn Kingsing, sorry. But yeah, you won. Sorry. Oh, we have one more. This is for, because we did the Q-Pin, so we have another one for CCO.
We have, yes, the CCO giveaway for.
This is for a blitz of your choice.
Yes.
So number 659, last one.
Thanks everybody for staying with us.
And we'll answer questions as long as you want. 659. Veronica Wales, you won the blitz of your choice. So any of the winners, just reach out to our help desk and Sylvia will get you connected and added and all that good stuff. So congratulations. And
Boyd put up the intern, just so you guys know that after you become certified, a lot of times people are looking for ways to knock that additional year off of their CPCA, or maybe you just want to get some diverse and unique experience. CCO does have a fabulous internship program, and it's really easy to find. Just go to cco.us/interns. You do need to be certified, and you do take an exam. We do vet you. Little heads up, I would suggest that you look into using Excel. If you're not savvy with Excel, brush up on your Excel, and coding for common disorders like diabetes. So just a heads up. We'd love to have you in our internship program. We've got a lot of really fun behind the scenes projects that we're working on.
Thank you to our existing interns. They are awesome, and they've had to deal with a little bit of our transition going from one platform to another for them. So yeah.
Real good life experience, right?
We have a very fun project we're working on related to ICD-11. We can't go into a lot of details, but you will learn a lot. This is not, you stapling papers as an intern. You're going to be definitely using your coding knowledge, and we're coming into that time of year where we're looking to update content with the new codes. So this webinar would be helpful for that and the CPT one to come. That last question. Well, I was going to answer that.
I don't know how to
Right.
take it down now that I put it up there. Oh,
Um,
I just thought that was really funny when I saw that come through, Boyd.
so she was asking about the on-demand. So yes,
Yes.
the recorded version will be in the club. What happens, this is how we do it, guys. We do this live broadcast. It's recorded. That goes into our system. It gets transcribed. It gets put into the club. We've already got the CEU quiz for the club members already set to go. When you watch things recorded, the AAPC and other organizations require that you take a quiz to prove that you actually got the content. When you attend live, you don't need to do that because you're proving you're here. We can see you in the chat, and we've got StreamYard telling us who actually came, not just that you registered, but you actually attended live. So we've got those kind of proof. So all you really need to do is get the CEU password and you're good to go. So you can get in and get that. We'll probably leave it up till tomorrow morning. And just wait till tomorrow morning. Please don't spam the help desk just yet. See if you get the email by the morning. Jesus
Have your
says
coffee first.
the server's getting hammered. It just takes time. All the emails are queuing up and are going out slowly. So go in and use that password. And when we're done here tonight, we're going to go in and chop it off from our streams so that no one has the password, just you guys who are here live. And we'll do it again with CPT in, like, I don't know, about 6 weeks or so, depending on how soon we get those new CPT manuals. Any questions? Anyone can leave at any time now, and we'll just, if there's any questions in the chat, we'll be happy to entertain them. Someone had asked about career advice. We can help with that. That topic request that Alicia had up, if you go to cco.us, contact us, we've got all these different forms. One of them is a topic request. Put that in. If you have career advice, and when we do our monthly webinars, we'll pull that in. Those are great questions. How to interview, we've done that before in the past. Also, if you go to our YouTube channel, there's that little search magnifying glass, and if you type in career or resume, you'll see we've talked about these things over the years. That's kind of evergreen stuff. It doesn't really change too much. So I would definitely encourage you to do that, but we're happy. Thank you, Boyd. So cco.us/topic-request, and put that in there, and we will, and these are some of the things that the interns help with. So if we get a coding question, we'll ask them to prep we call it an answer sheet first, and then Alicia and I will vet it, and we'll present it at the next Q&A webinar. So we'll keep doing that. So if you have a real burning question, do that. Now in the club, you get a little faster response. Some people will post entire op reports, and we'll try and help them code it. We don't code it for them. We ask them to tell us what they think the codes are. So at least it's not like, here, do my job and code it for me, and we'll go help them do that. Do your interns ever convert to employees? Yes, we've had that happen.
Yep.
And as we grow, we are, I really actually should have included that on the commercial slide. We are going after, and Boyd's helping us with that, marketing to business now. We're looking to expand our auditing services and our contract coding services, which we've always done kind of quietly on the side, but now we're trying to do that in a bigger way. So as we grow that, so if you have employers or referrals of people that are looking for contract coding services, auditing services, provider education, we can do that. And as we grow that division, then we will be onboarding more staff. So yes, that's the nice thing about having interns, is we can see who the superstars are and snatch them up. And we've done that in the past. We had Ruth, who would go, you got a typo here and you got a typo there. And so I told Alicia, you know what you do with students like that? She's like, what? I said, you hire them.
That's right. We've hired 3 interns total since I've been with Laureen. So, through the years. So that's great news. And someone had asked, is the internship would work with billers? Yes, we do. And knocking the A off, predominantly most of the interns come to us for that, because your education that you get, if you get your education through us, that knocks a year off, and then you have another year and man, we can keep you busy, and it's diverse and fun stuff that you get to work on.
Yeah. And so risk adjustment too is really big. That was what Alicia brought to the table when she very first joined us long ago. And I'm like, what is that? And HCC and risk adjustment. So that's kind of where definitely exactly what Alicia said was coming, and it's here. And for anyone who's not certified yet, maybe you were just checking us out, the risk adjustment course is a great one to start with, especially if you're on a budget, because you only need one manual. You're going to focus on the diagnostic codes like what Alicia was covering tonight. And then you can go and get a second credential later, maybe get a physician-based credential. So that way you can just start with one manual and then you add the CPT for the second phase. And I used to, many years ago, recommend it the other way around. Get your CPC or your physician-based, where it's 3 manuals, CPT, ICD, HCPCS that you're being tested on. Now I say, no, go for the risk adjustment, because there's lots of jobs out there, and go for the CPC or physician-based credentials. So
yeah, there's a lot of exciting paths now, and I would say that, like the QPIN, that you pick that up, that makes you more marketable for an office position, and it is it would be a good learning experience as you develop your skills of what it's like to work in an office, to be able to offer that service kind of behind the scenes. So
and
all
thanks
those
to
are good.
COVID, more people really do not have a problem with remote workers now. So there's a huge market for that. It's really opened up, where before risk adjustment was kind of good for
That's
that.
the only, yeah, that was
Other
about it.
positions, I'm like, you probably have to work in an office for a year or two until they kind of feel
Trust
comfortable
you.
with you, and then they'll let. Now it's like they don't even like bat an eye at it, and they realize they saved a lot of money on
Yeah.
office equipment and staff. So
That's why I'd also encourage you to bring up your that you can go get YouTube videos and stuff. Start learning Excel. That would,
yeah,
you need to be pretty savvy when you work remote with
yeah.
Excel. But
Just to say one more time, we know that the emails are coming in slow from signing up for the free forum. So just be patient. Check tomorrow morning. If you don't get it by tomorrow morning, then you can reach out to the help desk and we'll check your name against our list of attendees. But just give it till tomorrow morning. I promise you will get your CEO if you were a live attendee here today. Through the StreamYard. I can't prove it for YouTube or LinkedIn, but if it was through StreamYard, we can do that.
yeah.
So, but at least you'll be signed up for the next one. So if you come back for the CPT one, you'll be all in the system. It'll go a
Yes.
lot smoother.
We
Tell
are
your friends. Tell your friends.
so glad to be back, and we look forward to giving you information that's pertinent to your needs. So again, let us know the topics and your concerns out there. We work a lot with provider education, helping you learn how to educate your providers to understand the code set a little bit. So reach out to us and we'll see what we can do to help your practice work better, or you have a more smooth office day. No more tension and stress. Let us help you out.
And check out Find a Code. There, we have a link for a little discount, and they are phenomenal. Of course, we both have purple in our logo, so they had us at purple. But it really is a good platform, very user friendly. I have a job, and on that job, I was using it, and one of my coworkers saw it, and they're like, "That's so much nicer than what we have." And so went to the manager, and now they all are on Find a Code.
Yeah.
So it really is a slick product, and and pretty soon, I think, when ICD-11 comes, because they say we're not going to have paper manuals for ICD-11, I think a lot of these certification companies are going to be all digital manuals. That'll be really nice, because I just said, I mean, it hurt to spend, what was it, $130 on a CPT manual. It's like, yikes. But it'll be nice to have it all digitized. The only thing is the bubbling and highlighting is really good for learning CPT, but I think ICD really works well in the digital world. So we're getting there. How do I claim the giveaway? You got to go to helpdesk.cco.us and open up a ticket and just let them know what you won. And she'll confirm. I've highlighted it on the spreadsheet what people won, and she'll get you connected. So if you won the Blitz, you're going to tell her which one that you want, and she'll get you all set up in the course area for that.
You guys, it's been a lot of fun.
Oh yeah, someone said they were able to do the certificate. So see, the email will come. Just be patient. Thank you for whoever reported that.
Yeah.
I didn't want poor Sylvia to walk in tomorrow morning to like 500 emails. Thanks for seeing you. So, all right.
I'll take this
Floyd.
out.
It was good having the band back together.
Yes, it is.
I'll take us out with a little exit video, and good night, everybody, and thank you for being with us today.
Bye, guys.
Ciao.
Bye.
Do you need more medical certification and business training? Learn more at www.cco.us.